Well, good afternoon and thanks once again for joining in as we come to you live from Dubbo with an update on the COVID-19 situation. I'm joined today by the CEO of the Western New South Wales Local Health District, Scott McLaughlin, and also the Mayor of the Dubbo Regional Council, Stephen Lawrence, and we'll have the Western Commander for the New South Wales Police Force at some point, Jeff McKechnie, joining us as well. Today is a fairly important day to be recognising some increases in numbers again. And just to clarify, there will be evolution of numbers each day. We will provide numbers from a local perspective that are verified up until, at this point in time, 9 o'clock this morning. So up until 9 o'clock this morning, we have a total of 16 new cases in Dubbo and 1 new case in Walgett. That now takes a total of 39 confirmed cases in Dubbo overall and 3 cases in Walgett overall, a total of 42 across the Western New South Wales Local Health District. Those are the numbers we have confirmed up until 9 o'clock this morning. As I said, numbers are constantly evolving. What we will do is provide the actual up-to-date numbers for that point in time each day at this time. Testing-wise, we have had some fantastic numbers again yesterday. At the Dubbo drive-through testing clinic, 3,600, which was amazing, and total across Dubbo, 5,000, a bit over 5,000 tests, which is fantastic. So well done. Keep coming out and getting tested. A big thumbs up again to the amazing staff that are there making it all happen, and thank you to you for lining up and doing what you need to do. Again, be aware that if you are going to the drive-through clinic, there might be some wait times. It's being extremely well managed now, though, and those wait times are normally somewhere between 1 and 2 hours, depending, obviously, what time you get there. So do be prepared. Do be prepared with food and water and maybe some activities for children that you might have with you at that particular point in time. But our testing clinics are remaining open right across the weekend. Keep in touch with your local councils around what's happening in your particular part of the world on that. And the good news about results back from testing, absolutely acknowledge there have been some issues. We are now, I think, completely caught up on some of the backlog issues, and from here on in, most of the results I'm hearing are within 24 hours, and if not, certainly a short time after, and definitely within 48 hours. But most of them are in fact within the 24-hour range, which is fantastic, and is giving people a lot of confidence to come forward. So we do want you to keep coming forward and being tested with even the mildest of symptoms, or if you have any concerns about where you may have been. Scott will talk a bit more about the concerned areas, and those venues of concern are being updated on a daily basis as well. We're now up to 20. I'll let him talk a bit more about exactly what that means. Main messaging though today is pretty simple. It's the same as yesterday. We need you to do the right thing and stay where you are. You can go out for essentials. That means essential food. But if you're in a family, it should just be one member of the family that does that. Not several, not as a group, not as a family outing. One member who gets essential food that is required for the family. If you're a single person or a couple, it's still one person that should be doing it. You can go for a walk to get some fresh air by yourself or with your partner, 2 people together. But again, stay away from crowds. It's about getting some mental health reprieve and some exercise. You can get medical attention, you can get vaccinated, you can get a COVID test. If you don't need to do it now, put it off. Simple as that. If you don't need to do it, try not to do it. And that message is about not spending time with family groups and friends. As difficult as that is the main way that this virus will continue to be transmitted, and that's why we're asking you, make phone calls, do FaceTime, whatever it takes, but do not visit face-to-face. Do not roam the streets just for fun. Do not go to the park and kick a footy with 20 mates. Stay at home. We need you to do that now more than ever. Look, there are lots of questions around where we're heading from here, and I think that the Premier this morning has indicated that there may be further stay-at-home extensions around the state. It's likely that that would include our region, and it's also likely that by this afternoon there will be larger areas of Western New South Wales included. But keep in touch. We will be updating that through the Western Health District when any new information comes to hand. One of the other questions people have certainly been asking is around education and how our schools are affected. I can tell you that Dubbo West Public School, after a deep clean, will be reopening for students who need to be there from Monday. It's of course been closed since last Wednesday. The deep cleaning has all occurred. The learning from home modules are underway. It will reopen on Monday morning for students who need to go there who do not have any other options. Similarly, for Macquarie Anglican Grammar School, which was originally closed at the same time, it will reopen from Monday as well, again for parents who need to send children to school because they're unable to do learning from home. That is the case in any of our schools, and just to clarify what that means, if you can keep your children at home and doing those learning from home modules, please do so. If you can't, there will always be the ability for our public schools to take students, and for independent schools, it's a school-by-school basis to work out with your local principal. The reason for that is that we have many people in our health district, the ones doing the testing, police force, you name it. We have people that are essential workers that we need to know can continue to go to work and have their family members, their children supported. So all of that learning is done in absolutely the strictest COVID-safe manner. If it's for anyone in Year 7 and above, all staff wear masks, as do students. For primary school staff wear masks. It's a bit more difficult for students too because they become a bit ineffective at times. But everything is done in a COVID-safe manner. It's very much reduced numbers at the moment. Only 2% of students are actually going to school in Dubbo. So 98% are staying at home as of yesterday. And only 18% of teachers are actually doing anything at school, as in the classroom, and they are there supervising the learning from home modules, which are what are being learnt at the school. So there's no extra curriculum being taught. The students that need to go to school are doing the learning from home modules, being supervised by those teachers. Only 2% of students, only 18% of staff currently at schools, which is showing that this is definitely working, so we want you to keep doing that. Just to clarify, the schools though that are now also being affected by closures, Buninyong Public School, Dubbo School of Distance Ed have both been announced as being closed as of yesterday. They will be undergoing obviously some deep cleaning. All staff and students asked to isolate until receiving notice from health. Dubbo College South Campus was closed Friday. That remains closed as well, as does Arana Heights Public School. We'll keep you up to date with those school messages as they come to light and as more schools are able to open again. And again, opening is just to provide what is needed for students that cannot learn from home. With that, I'll hand over to Scott for his update on all of the cases and where things are up to. Thank you.
Thanks, Dougal. Good afternoon, everybody. We've got, again, another concerning situation and very rapidly evolving. We've now got a total of 42 cases in Western New South Wales. As Dougal mentioned, 16 additional cases in Dubbo and 1 additional case in Walgett. There's still a lot of contact tracing and investigations underway for those additional cases, but what we do have is 11 unlinked cases in those numbers that we're still tracking down the originating case or the contacts for those people. We've got over a couple of hundred people as close contacts for those 42 cases. So they're all in isolation and being tested, but there's obviously a risk of growing numbers in coming days with that extensive contact. We still have a significant number of our cases and the new cases within the Aboriginal community, both in Dubbo and in Walgett. There's a large proportion of those, again, children and younger people. So the steps we're taking is providing a lot of support and testing ability for Aboriginal community and our broader community across the whole of the region. Yesterday we saw over 9,000 tests done right across Western New South Wales, so to the whole of the region. Thank you. That's amazing. We know that there's some real fear and concern, but there's real risk with COVID spreading around our region. As Dougal said, over 5,000 tests were done in Dubbo yesterday and over 3,000 in a lot of our smaller rural communities. We have testing sites available across Dubbo in the drive-through at the showground, the Monera Clinic and the West Dubbo walk-in clinics. Please, in Dubbo, today is the time. Don't hesitate. It's a Saturday. I know it's beautiful weather outside. Please stay at home and isolate, but come and get tested if at all possible. We now have over 20 locations of concern that have been identified where we have had either cases or close contacts in those locations. That list is being updated on a more regular basis. Go to the New South Wales Gov website and the COVID components of that, and please keep an eye on those evolving numbers. In the last 24 hours, we've seen another sewerage result, and not surprisingly, come back in Walgett. In the last 48 hours, we've seen the sewerage results come back for Bathurst, Parkes, Burke and Dubbo, and not surprisingly in Dubbo. So for people in those communities, please come out today and get tested. If you've got any symptoms, however mild, any concerns that you might have, please come and get tested in those 5 locations. As I said, the testing numbers have seen a significant boom in the last 24 hours, that we want to see that continue. In the last 24 hours, we also saw 300 people come to get tested in Mudgee, 288 in Bathurst, Orange 259, and Parkes and Forbes, between those two, about 350 people. So please, today's the day to come forward and get tested. Any symptoms, however mild, or any concerns, those drive-through clinics and walk-in facilities at our local hospitals and health services are available through that time. Vaccination, we've seen a significant boom of the numbers of Pfizer doses being delivered in Western New South Wales. On Thursday this week, we saw over 7,000 new vaccination supplies from the Commonwealth come in Pfizer supplies, and 2,000 additional from the state system. So over 9,000 additional doses come in on Thursday. Yesterday we saw in Walgett nearly 200 people getting vaccinated, and already today that's more than 200 people have been vaccinated today. So please, in Walgett and the surrounding communities in Lightning Ridge and Collarenebri, please come and get vaccinated very quickly. Into the broader community across Burke, Brewarrina, Lightning Ridge, Walgett, Canamble and the communities around that, please come and get vaccinated. There's vaccines increasing in those communities through both the general practices and the Aboriginal medical services. Likewise, right throughout the rest of our region, we've got our vaccination hubs in Dubbo, Orange and Bathurst open 7 days a week, increasing our supply into those centres from Monday this week. That has seen the return of a lot of the appointments that were paused for a period while we saw a decreased supply come into the region. So those appointments are being made. We are fast-tracking people into those. We know that there is going to be a couple of weeks to get all of those appointments remade. As Dougal said, there was some signals around broader stay-at-home orders being considered today. With the broader spread of COVID we know in our region, and the sewage tests going off in both Bathurst and Parkes outside of the stay-at-home orders, I do want to ask people, stay at home in those locations wherever possible today. Today isn't a time to go out and do a barbie with your mates. Go down to the shops for a long time. Stay at home. There is no question, right across Western New South Wales and far West New South Wales, today's the day for us to stop COVID dead in its tracks. So I'll pause there and hand over to the Mayor of Dubbo. Thanks, Steve.
Thanks, Scott. Steve Lawrence, Mayor of the Dubbo region. I'd like firstly this morning to send a message on behalf of the community of sympathy and support for those people that have tested positive to COVID-19 in the last little while. We know that this is incredibly stressful, a really anxious time for you. We know that you haven't done anything wrong, you've just been unlucky. So on behalf of the community, I want to send thoughts your way. Everyone is wishing you well in your recovery and hoping that this really difficult time is as easy as it can possibly be for you. I want to thank all members of the community who have responded so well to what is effectively a crisis. We have seen incredible rates of testing. We have seen incredible rates of compliance with the stay-at-home order. If you go down the main street of Dubbo at the moment, it is virtually empty, and that is how it should be. Scott has pointed out that the large majority of these new positive cases are Aboriginal people in Dubbo, and they are in turn the majority of them in West Dubbo. Really, really important for the Aboriginal community to be strong advocates, as they have been, on this issue. We've had a great reaction from a whole range of Aboriginal leaders, sports people, elders, all sorts of people who've been coming forward. They've been making social media videos, They've been contributing to the media, been speaking out loudly to their community on the need for everyone to stay home. Stay home in Dubbo. If you have any symptoms or concerns, then go and get tested, but stay home. That is the most important message. I think it's important at this time for community leaders and politicians and so forth to acknowledge that not everyone receives our messages in the same way. We're trying to be as clear as we can be, and I know that most people listening to this video understand well exactly what we're saying. But our community is really diverse. Not everyone hears the messages, not everyone is in the same circumstances, not everyone understands the messages in the same way. I'd like to send a message to the Aboriginal community, call upon all members to be advocates in your own community. If you're an Aboriginal person living in West Dubbo, for example, you can help by contacting your family and friends, especially people that you think might not be hearing these important public messages. Speak to your sons and daughters, speak to your nieces and nephews, speak to your cousins, speak to young people, speak to your family, explain to them the really urgent need to stay home. The majority of these new cases are young Aboriginal people in West Dubbo. The coronavirus is moving through the Aboriginal community in Dubbo, and that's particularly among the Aboriginal community over in West Dubbo. So important that everyone gets this message out there. Stay at home. If you have any symptoms or concerns, then go and get tested. Thank you.
Thanks, Dougal. I might just finally update. We don't have anyone in hospital with COVID-19 at the moment. The 2 patients that were admitted the day before yesterday were discharged yesterday. They've returned home and they're being